Namaskar. Welcome to Health Hour by Apollo 24/7 Experts. Here's a show where we bring you experts from Apollo hospitals every week. 11 to 12 is where the expert is live on the show and you can ask all the questions that you've been postponing. So you can join us on Instagram, Facebook, and YouTube channel. You must be watching this on all these platforms, but if you have a question or a query to be answered, please join us on YouTube chat where you can type in your question and I shall place the question before our expert for an answer, which is going to help a lot of people. And on the show, you also can expect a health quiz where you can win gift vouchers from Apollo 24/7. Also, we are going to give away discount vouchers and gift vouchers on the show. Please stay with us, and I urge you to download Apollo 24/7 app, which brings the entire hospital into one app. Just by a click, you can actually book tests, you can buy medicines, and also you can consult the specialist. चलिए आज का टॉपिक है हमारे लाइव शो के लिए वेट मैनेजमेंट इन डायबिटीज थायराइड लिवर एंड स्लीप डिसऑर्डर्स बेसिकली इन chronic conditions. What can be done to manage our weight? And today we have a specialist who is a bariatric head from Apollo Hospitals, Greens Road, Chennai, Dr. Raj Palaniappan. Let me introduce you this wonderful expert who is more than who has more than 22 years of experience in his field, and he's a member in Obesity Surgery Society of India, European Association of Endoscopic Surgery as well, Indian Association of Gastrointestinal Endosurgeons, International Federation for the Surgery of Obesity, and he can be consulted for single incision laparoscopy, endoscopic sleeve gastrectomy, revision weight loss surgery, and diabetic or metabolic surgeries as well. So today on the show, we are going to meet Dr. Raj, and who's joined us now. Good morning, doctor.
Good morning, everyone. How are you doing?
Wonderful, sir. Thank you so much for joining on Sunday morning. And Dr. Raj, today is a very heavyweight championship topic. I'm assuming a lot of people would want to join us on this live show. So,
That's true.
yeah, it's a huge topic. It's a big topic. But to narrow it down, weight loss, सबका issue है. Everybody wants to lose some amount of weight. But today's topic, we are going to talk about how weight management is important in chronic diseases or conditions. So, to give us a brief, can you please make us understand why weight management should be important for our good health?
So, to start with, weight is supposed to be the most dreaded specialty as of now in the world because more than 60% of all diseases and deaths are somewhere related to obesity. And with so much of high volume eating, so much of a stress, lack of sleep, professionally getting into some kind of a big kind of a cat on the wall scenario with performance to a lot of stress related work and overworking, along with some kind of a metabolic issue that goes in the body since our birth because of the way we eat, the situation, the climate. Plenty plays a role, and we end up having diseases pretty early. And these diseases are reducing our lifespan by 6 to 8 years minimum. With
अरे वाह.
obesity or weight in the process, that gets more than 10 years of lifespan is lost, and more than 25% of your life you are wasting on treating yourself from a diseases. For these reasons, maintaining your weight is very important, and if you have gained weight, losing it early is pretty important to have a good quality of life.
Wonderfully explained. And we are living through the season of plenty, as you have mentioned, that everything is plenty. Jitna food is plenty, options are plenty, and also stress is plenty, and weight is also plenty. So now let me understand. This is a cycle. If we have a chronic disease, thereby you gain weight, and thereby the chronic disease is also increased. So there's a cycle here. Which comes first? Is this that egg or the chicken story, or can we break this cycle?
So it all depends upon whom you are meeting. If you are meeting a obesity physician, we say obesity brings everything. If you meet a diabetologist, they say you have metabolic diseases and that is why you have obesity. But at the end of the day, it's not important to know what came first. it is important to understand what we can do with the kind of body you have. So what we always say is, though obesity is the primary reason for lifestyle diseases like sugar, BP, and cholesterol, liver diseases, sleep disorders to come in, it all triggers from some point of lifestyle changes what we get into, basically because of the kind of the life we deal with, from the kind of student peer pressure, kind of what we call as a junk food eating, more sedentary lifestyle, less physical activities, and continue that into adulthood, so much of a stress at work, lack of sleep, and then getting into a family situation, financial issues, and then you get children, their education, everything becomes stressful in life. And this lifestyle is the main reason why we get into this kind of a problem. And for that reason, we have to tackle them pretty early. And if we don't tackle them, as I told you before, we tend to have a lifespan that is going to come down drastically. So we cannot blame you overeating as a reason for weight loss. You can't blame stress. You can't blame sleep. It's a multifactorial, and as I said, it's a vicious cycle. One lead to other. A simple work stress can lead to obesity. A hormonal problem lead to obesity. So that's what we always say: get a better professional help when there is a weight issue, and not treat from what you know or what you hear from your neighbor. This is very important to understand where you stand and what could be the reason and how to manage them.
Wonderfully said, sir. ये दुनिया है, we've reached to a phase where our technology has connected us so much that we share information left, right, and center. And internet is here. The university, everybody thinks that they can do whatever that internet preaches. But here there's a risk that I might lose weight on something, but somebody else might not lose the same amount. So why is it very difficult, and why is it very individualistic approach?
So this is where we specialists come in, and we talk about specialist in the sense it has to be obesity specialist and not an endocrinologist or not a physician. So what happens in our body is made up of water, your muscle, your fat, and other minerals and vitamins and other organelles, tissues, connective tissues, bones, and a lot of things. But when it comes to weight, the percentage of fat to muscle is important, as well as where the fat is stored, the what we call as visceral fat or fat around the belly, that's important, as well as the kind of a muscle strength you have, the percentage of muscle you have. Muscle equal to metabolism and fat equal to more metabolism, more calories, and carbohydrate for you to have the calories to work for your day. So we understand everything by a body composition analysis, and accordingly will guide you. So if somebody is fat because of more muscle, like a bodybuilder, just because he is heavy on the scale doesn't mean that he is going to have a more problem. Whereas the same person, if it's more of a fat involvement than the muscle involvement, then you are prone for more diseases because your fat is more than the muscle. Muscle is equal to metabolism. Your metabolism might be high, but because your muscle is there, but the metabolism will be bad if there is more fat. So, depending upon what kind of a body composition you have, we recommend whether you need to exercise more, we need to reduce, or diet more, or you need to do any medications to help your metabolic effect. Plenty of combinations are available. So a scientifically right kind of a consultation is important. Then you go to a physician, you go to a nutritionist, you go to a gym for the physical therapist, whatever you want to do at the end of the day. The base of a serious specialty consultation for obesity is pretty important. Then you can go ahead with whomever you wanted to.
Wonderfully said, sir. So there's so much of confusion now here that who should I consult? Weight management, first thing that we think is a diet issue and a lifestyle issue, and we hit either a gym or consult a dietitian. But as you've said, there's something more serious with it. There's a lifestyle disorder. It's not just a lifestyle disorder. If there's a chronic disease which is involved, Can you also please explain what are the chronic diseases and one has to watch out for? In the meanwhile, there are a lot of people who have joined. I'm going to take your questions, Sumit ji, Induja. I'm going to take your questions, Vishnu, your question also. But please give us a little more time so that others are also joining. In the meanwhile, doctor, what are the chronic diseases which can cause obesity and where obesity can cause trouble in these chronic diseases?
So these lifestyle chronic diseases and obesity are interlinked. If you develop obesity, certain organs are affected early, or if some organs are affected, obesity can be a part of the side effect of it. So
Okay.
we have initially something called as metabolic syndrome X, sugar, BP, and cholesterol. These are all three diseases which is because of the fatty acid circulation in the blood. More the fat in the blood, these diseases are invariably going to hit you at some point of time. If your parents or you are genetically prone to diabetes, then you get diabetes early. If you're prone for hypertension, you get them early. If you're prone for cholesterol, you get them early. Two of these three diseases come in, the third also comes in, and these three diseases put together, you have a higher risk of cardiac problem, higher risk of kidney problem, higher risk of fatty liver disease, and this will affect your heart, and you will have a heart attack early. You will have a fatty liver disease which goes into liver failure. You go into a renal problem, and diabetes becomes very severe, and this leads to a lot of diseases. Then there are hormonal problems. Women will have PCOD or a polycystic ovarian disease, infertility if they are obese. Or if they have a polycystic ovarian disease when they start their menarche, then they will gain weight as well. Who are lean before, they say exactly after I attend my periods, I started putting on weight because the hormonal imbalance will make them obese. Then infertility comes with it. Then you have thyroid problems. You have a lot of hormone problems, pituitary issues. The pituitary issue can cause obesity. Thyroid can cause obesity. If the organs or thyroid problem is there, then they cause obesity. Obesity can make the thyroid organs function less. So it's all interlinked. So what comes first is not important. What you have at this point of time is important. And these are all the diseases which can really lessen your lifespan. That's why we say take care of obesity. Taking care of this one problem can have an effect on multiple diseases, and that is why obesity is taken very seriously in the world right now.
Right. Sir, I understand that that this is not what you have is not important, but what is not suiting you. You have to change your lifestyle. You need to understand what is happening with your body. So, what are the tests that one can take? Because we want to understand that it's not just coming from your lifestyle, not just coming from your food. Any basic tests that one has to do to understand where their weight management has to start?
So the brilliant concept, which is very cheap and done, is called body composition analysis. You go to
Okay.
a gym, there is a machine called body composition analysis machine called BCA machine.
Absolutely.
You stand on that, they will ask you some two rods to hold in your hand, and it's more like a weighing scale. What it does is it gives you what you call height and weight and a body mass index. Depending upon your height and weight, it gives you a variable called body mass index that needs to be assessed. Then your muscle mass, your fat mass, your basal metabolic rate, what is your metabolism in the body, then the water content, then what is the fat content within the organ. For example, visceral fat content is the fat content in the organs inside. So these are all, and then waist hip ratio. Between the waist and hip, what is the ratio? These are all our parameters which will tell us where you stand with your weight and what are the likely issues that can come with it as a non expensive parameter. Then, if you have problems, family history of sugar, family history of hypertension, then measure your BP, measure your random blood sugar. If you have a random blood sugar issue, measure your other parameters of C peptide, insulin, a lot of enzymes, hormones are there. Then, ladies, your hormones of estrogen, progesterone, all those ovarian hormones, all those things can be then have a thyroid assessed. These are all the basics test along with the nutrition. Again, I'm telling you, deficiency of nutrition can also bring obesity. So, if you have B12 deficiency, if you have iron deficiency, calcium deficiency, also you can have obesity. So, tend to understand your nutritional status as well. With all these parameters, we will know where you stand with obesity. So, a simple non-expensive test like a BCA to a 10,000, 15,000 blood test analysis, anything we can do to understand your obesity. And this is where specialists come in to tell you where you stand by doing all these tests. And accordingly,
Yeah.
you'll take up with your weight loss plan wherever you need.
Wonderful, sir. And I 100% I'm sure that Apollo 24/7 has packages which are specifically designed by physicians, which can help you, like, cholesterol or, diabetes if somebody has. All these are very important, and these packages can be found on Apollo 24/7. Do get your self test. So here, let me start with the questions. Sleep questions are what I would want to take up first. So the magic word metabolism that you have been talking about, doctor. First, Shubhangi Shukla. Shubhangi is 36-year-old female, overweight hai, she's diabetic, endometriosis, unable to sleep. I have sleepless nights. Please suggest solutions. And also Sumit Arora, इनका एज नहीं दिया है. I understand from the name that he must be a male. I'm facing a sleep disorder due to evening shifts, unable to sleep in the night or even on the weekends too. Please provide solution. Is that going to affect his weight? So there are two different cases here.
Yes. So what happens is there's something called circadian rhythm. We as humans have to sleep in the night when there is no sunlight. Unfortunately, the guy who said he does night shift, and the lady said that she has some endometriosis, a lot of hormonal issues,
Diabetes
and
and
definitely,
obesity.
yeah, obesity. So definitely she's very stressed. So any stress will give you less sleep, and
Ah,
changing your circadian rhythm when you are not sleeping in the night and you are working in the night, definitely you will not get good sleep, and that will increase your stress level in the daytime. Even though we think we are not stressed, body is stressed. When the body is stressed, naturally sleep comes down. When the sleep comes down, what happens? The body functions during the day when the metabolism has to be at the peak, will not be good. So that is why if you go to a gym, they say the first question you are tired means the first question the gym instead ask you is,
did
doc
you
or
sleep?
anybody says, did you sleep well yesterday? Because you lose your metabolism, body will not spend enough during the day when it needs to spend. So for
Absolutely.
1 week, 2 weeks down the line, you burn less and you gain weight, or your strength is so less, you will not burn enough fat. That is the reason why stress is very important. And of course, when you have diabetes, you have endometriosis, there is a hormonal imbalance which will help you to store more fat as well as store more water. So that way you gain weight, not necessarily eating more. Because of these reasons, you gain weight. So the obesity in the first indication could be because of stress plus hormone problem. The second guy, it is only stress because of spoiling the circadian rhythm.
Right. So let's address Sumit's question. Somebody who's working, and this is like a new generation, doctor. The entire generation. Yeah, please take a minute if you need to, doctor.
Yeah.
Yeah.
So go ahead, go ahead.
Yeah. So please, I'll continue with a few more sleep questions. योगेंद्र कुमार वशिष्ठ, डॉक्टर साहब, अगर नींद नहीं आती है तो क्या मेलाटोनिन सप्लीमेंट ले सकते हैं क्या? So a lot of people are facing sleep issues, which could be stress, which could be work related. The next generation, the generation right now is working in the nights, and you cannot help without working. So how can we address this, and how can I improve my metabolism in the day?
So there are two primary changes that these people who work in the night has to do. In the daytime, the best way to sleep is have sun controlled screens for your windows. So there
Ah,
are now materials available. So it has to be as dark as possible, and there should not be disturbance. So you should not ask your family members to keep disturbing you during your sleep, and you should be having a lot of darkness for you to sleep. And that is when melatonin is secreted in the body. So melatonin is very important for your sleep. The more the melatonin is secreted, the more you sleep, and that is why one of the guy who asked the question asked that, can I use
can
melatonin?
I take melatonin?
If yes, so if you are not able, body is not able to secrete enough melatonin, it is nothing wrong in getting external support. So melatonin is a very good non-habit forming medication, but it's a naturally occurring enzyme in our body. We are giving it synthetically. That's not wrong if you're not able to sleep. Instead of trying to be rigid and saying that I don't want to take anything supplementary for sleep, better to sleep by taking supplements, and especially when you're not taking sleeping pills, it's good. So melatonin is a good supplement, but still change these kind of habits. And then the worst part is, again, if you have blue light when you watch TV, when you watch your phone, melatonin will not be secreted enough. You will not be able to sleep enough. So you should have at least 1 hour of time before you sleep without watching a TV or a mobile or anything. Do this small kind of a change. You don't have a coffee. You come back and have a coffee in the morning at 6 o'clock and have a food, have a coffee, then how can you sleep at 7 o'clock? You can't. You should have at least 5 to 6 hours of coffee free time before you sleep. You know that? That's very important. You should be sleeping well means you should not have coffee beyond 6 p.m. in the night, evening. Same way, you come back at 3 o'clock, 4 o'clock in the morning, you should not have coffee from 11 p.m. But to work in the night, you take so much of a coffee, keep yourself with so much of energy, and suddenly when you come back home and you want to sleep, you are tired. But body is running because of the caffeine. You can't do that. So 6 hours of not having coffee, tea, 1 hour of not watching TV or any electronic gadgets, and come back and make your room so dark. That's the only way you change yourself and sleep and not being disturbed. So this is the only way you should address. If not, add melatonin. That is the only way right
Wonderful, sir.
now.
Because that's a very
Naturally,
practical advice that you've given for the working generation, the entire generation which has been working in the nights. Wonderful, sir. Thank you. And Shubhangi Shukla, while she was asking about diabetes and endometriosis, let's talk about hormonal issues and especially how weight management is very important for diabetes, where people either lose weight very drastically and their weight adds to their diabetes problem. Can we talk about diabetes here, sir?
yeah. So one thing we should understand is every hormonal problem is related to insulin resistance. So what we call as insulin resistance is body will have a hormone secreted called anti-incretin, which gives resistance to secretion of insulin. Why? When we eat, body needs to get all the energy for digestion. So it shuts down all the activity and puts all the effort in digestion. So for this hormone is secreted. In obese individuals, this hormone is more. Or when there is a genetical makeup of obesity in the family, diseases in the family, family of sugar, BP, these people have a anti-incretin hormones more insulin resistance. Once the insulin is resisted, then diabetes will happen. Then the PCOD or the hormonal issues. Every hormonal issue starts with insulin resistance, not necessarily
G.
diabetes. Even we don't need a diabetes. Insulin resistance can cause even PCOD.
G.
So your ovarian hormones also are linked to insulin resistance. If the pancreas is very good, you will not develop diabetes. But the ovary is bad, you develop ovarian problems. If the thyroid is bad, you develop thyroid problems before the diabetes. So everything at the end of the day, say no. A good, a best way to a man's, heart is to his stomach. That is basically not, yeah, not for a man. It is for any human being. So everything starts from the stomach. We have stomach as the largest endocrine organ in the body. Everything is linked to what we eat and the insulin and other hormone secretion balance. This balance is completely jeopardized when we eat more, when you have a family history of a problem, and all these things. So, this insulin resistance will affect every hormone in the body. So the first hormone is diabetes, second hormone is periods hormone with ladies, then the thyroid hormones commonly affected. Any other hormone can also be affected, but these are the main hormones. The enzymes secreted by the liver, the kidney, the heart, everything can be affected. So primarily is the insulin resistance. The insulin resistance starts with a good problem with the eating. So, and the wrong timing of eating. So that is why they say even if you are eating healthy, if you are eating in the wrong time, if you're eating the wrong way, the wrong food, you will develop. You cannot blame saying that I don't eat anything at all. I eat very less and still develop diabetes. It's all depending upon the kind of a food we eat, how your body reacts. That is why we always say a good consultant opinion is important to understand your obesity and not going to your neighbor or an influencer who knows how he or she are lost weight, because two individual bodies are different. They react differently to everything.
Absolutely, sir. So while we talk about diabetes, there's Ramesh Thakur, who is also diabetic patient, control mein hai, but sleep disorder hai. And Shubhangi also is asking ki, what can be my solution? So I have a friend whose diabetes was magically managed by a bariatric surgery. So I was not understanding why this bariatric surgery had come in place. She was not really obese, she was not really overweight, but suddenly one day she disclosed that she had a bariatric surgery and that's for her diabetes. Can we please throw some light on what's the connection between and how can one understand who requires bariatric surgery?
So I told you about insulin resistance. The insulin resistance is the main reason for diabetes. This insulin resistance is because of the anti-incretin hormones secreted by the intestines. What happens is there's a hormone called GLP-1 which is also secreted in the intestine. This GLP-1 hormone suppresses the insulin resistance and increases the secretion of insulin, as well as give you what we call as a satiety. You feel happy eating something and you'll feel full early as well. And then this hormone triggers all the other hormones to function at its best. So they increase their metabolism, suppresses the insulin resistance, and every functions are better. You burn more calories and you lose weight because you feel full early. You will not overeat as well. So this one hormone GLP-1 is the trump card. This hormone is increased by 90% post bariatric surgery, and that is how it triggers the control of diabetes, irrespective of weight loss or not. The same, nowadays we have a drug called semaglutide, a new drug has come into the market, which can give 10 to 20% of this activity without surgery as well. So
Oh,
that medicine also controls your weight as well as your sugar as well. So these are all the reasons why diabetes is well controlled, and all these actions start from the intestine. So if you feed yourself well, you can escape all the disease process. And then that's why they say have a balanced meal, be conscious about what you eat. So a good balanced meal with some kind of activity and food which increases the GLP-1 secretion helps to avoid obesity and diabetic control. Bariatric surgery does that by a guarantee, because human mind cannot be controlling what you eat, what you do all the time.
correct, doctor. So here's another question. Dilip Chatwalji पूछते हैं, does acidity lead to sleeping problem? That is Dilip's question. And next question is Chandrik Kothari. Can acidity be reduced? I am having obesity and thereby acidity. And there's one more question. Excuse me, sir. Um, GERD and obesity. Can GERD cause or obesity
So
cause GERD? So let's talk about the entire
yes,
gastrointestinal.
so, yeah, everything is the same. Comes to the same process of what will happen if you are obese, or what will happen when you are more acidity. So when acid is more secreted, or when you are obese, what happens? The pressure in the stomach becomes increased. So what happens when the pressure in the stomach increases? There are two valves on both sides of a stomach. One in the upper part of a stomach, one in the lower part of the stomach. They close, and the stomach behaves like a mixie to mix all the food and acid and bile. When this muscle is becomes weaker because of the increased pressure because of acidity as well as the obesity, the weakest of them is the upper part of the valve. So the food and the bile and acid reflexes or comes into the
Come on.
chest, esophagus. The esophagus or the food pipe is not covered by a lining which will protect you from the acidity. Acid coming into the food pipe, it erodes. Acid inside the stomach will not erode anything because there's a lining there. So that causes more severe acidity, which is called as a reflux disease or GERD.
Ah,
In obesity, because of this pressure, this increases, and because of this you won't be able to sleep well because acid evaporates, and this evaporation causes dryness of your throat, causes dry cough. That is why sometimes when you cough, when you have chest pain, you think it is a heart problem, but then basically it's a acidity reflux problem. So you will be
Right.
uncomfortable sleeping lying down. You can be sleeping maybe sitting up, because without gravity, the acid will flow back into the food pipe and cause more trouble. So these people will not be able to sleep well. When you're not sleeping well, stress increases. With that, you can lose weight or even gain weight as well. When you have obesity, reflex is a guarantee. But when your reflex is there and non-obese, you will not be able to sleep well as well.
So, how can you help some people who are facing these problems? Are there
Yeah.
any other treatment options available? Is it through medication? Is it through lifestyle management or any surgeries?
Okay, anything to do with the digestive system, the first thing is a lifestyle management. So you have to reduce your stress, we have to increase your sleep, but it's easily said than done. So to address this bit more easy, we will start with a diet. Diet wise, there are a lot of reflexive food, like avoid milk and milk products, avoid eating late in the night, avoid eating unnecessary timing, avoid eating full stomach. So increase the frequency of eating. So that way you change the kind of a food, and then don't eat too much spicy food. Eat more balanced food, more protein based food and fiber based food than carbohydrate food. Reduce your sweets and sugars. So these kind of things are, we will say, to avoid acidity, and as well as a balanced low calorie meal will help you to lose weight as well. But there are times when acidity is so severe, we need medications to reduce the secretion of acid, decrease your reflex by moving the acid and the bile out of the stomach faster. There are medicines which throw the acid and bile out of stomach within 5-10 minutes. So instead of
Oh.
acid building up and coming reflexing up, it goes into the small intestine. So the stomach becomes empty. So there are medicines to do that, medicines to neutralize acids, diet changes, weight loss. These are the ways to help your acidity and reflux scenarios.
Wonderful, doctor. Thank you. So here's the next question from Vishnu Kondapalli. Vishnu has been facing obesity since his childhood, and no amount of exercise helps him. He's 31-year-old, 5 feet 4 inches, weight is 75 kilos, and BMI is 29.
So, the ideal thing to do for him is to meet a, what we call a bariatric consultant, either a surgeon or a physician who knows how to analyze and how to diagnose the severity of obesity. So, we will take your body composition analysis, like I told before, plus plenty of hormones and enzymes to understand your body. What is the reason for obesity? Whether it is more calorie eating, or spending less amount of calorie by exercise, or you are eating food which are going to store more water or store more fatty food. Then do you have any disease process like thyroid, or you have like diabetes or a pre-diabetic scenario which is spoiling you? We understand all those things, then nutrition issue,
So I think,
then
yeah,
we
I
will
think
guide
without
you accordingly.
consultation, proper consultation is required. Vishnu, we have left Dr. Raj Palaniappan's link to consult in the chat box as well as description as well. Apollo 24/7, you can consult him and take it further from there. Thank you, Doctor. Doctor, here's Johnson's question. Good afternoon, Dr. G. Could you please describe whether the role of regular exercise early in the day does benefit in both sleep and obesity problem?
So, see, what happens is your body has the maximum metabolizing capacity in the mornings. So, always better doing exercise in the morning to lose weight. And as well as the there is an advantage as well as disadvantage of doing exercise in the morning. Advantage is you burn more calories. At the same time, you will be having lot of adrenaline rush in, lot of happiness, serotonin, endorphin rush in. So you feel so good and active throughout the day.
Yeah.
The flip side is, if you don't feed yourself well with enough protein and enough carbohydrates, you will lose the energy pretty early. The mistake what people do is, in the name of weight loss, in the name of good physical activity, they tend to get less carbohydrates. Believe me, carbohydrate is very important for you. So we always say eat carbs before exercise. The all the carbs are used for the energy during exercise, then add protein after the exercise, then you will be able to build up more muscle. So you lose fat more, build more muscle, so that you maintain the weight loss better. Instead, what people do is no carbs at all, only protein. What happens? Then the body burns the muscle to take the calorie. So you will not gain any muscle, you will only lose some fat. But when you stop exercise, you put on so much of a fat. That is when the yo-yo diet, the effect
If
happens. You tend to put on weight after you stop exercising or dieting because of these reasons. So you have to be balanced. Carbs are important. Maybe you could reduce the carb, but no carb diet is dangerous for you.
Wonderfully put, doctor. So quickly, I'll do this in Telugu for the audience who are watching in Telugu. కార్బోహైడ్రేట్స్ అంటే మీరు కేవలం రైస్ లేకపోతే గోధుమలు ఇవన్నీ అవాయిడ్ చేయకండి. ఎక్సర్సైజ్ చేసేవాళ్ళు ముందు కార్బోహైడ్రేట్ తీసుకోండి, తర్వాత ఎక్సర్సైజ్ చేయండి, ఆ తర్వాత ప్రోటీన్ తినండి. ఒక తగ్గించడం అన్న తగ్గించండి, కానీ పూర్తిగా దూరంగా ఉంచేటువంటి వెరీ లో కార్బ్ డైట్స్ మాత్రం చేయకండి అని చెప్పారు. డాక్టర్ రాజ్, వుడ్ యూ వాంట్ టు యాడ్ సంథింగ్ ఇన్ తమిళ్ హియర్ ఫర్ ది వ్యూవర్స్?
எஸ் டெஃபினெட்லி. அதாவது புரத சத்து வந்து எவ்வளோதான் முக்கியமாக இருந்தாலும், இந்த ஃபைபர்னு சொல்லுவாங்க, அதுவும் முக்கியமாக இருந்தாலும் கூடவே கார்போஹைட்ரேட்டும் ரொம்ப ரொம்ப முக்கியம். ஸோ நீங்கள் சாப்பாடு சாப்பிடும் போது மேபி என்ன பண்ணலாம், கார்போஹைட்ரேட்டை நிறையா காலையில் சாப்பிடுங்க. ஏன்னா உங்களுக்கு 4 எனர்ஜி தேவைன்னா கார்போஹைட்ரேட் யூஸ் ஆயிரும். அதை விட்டுட்டு கார்போஹைட்ரேட் கம்மியாக சாப்பிட்டீங்கன்னா எனர்ஜிக்கு மசிலை தான் அது பேர்ன் பண்ணும். மசிலை பேர்ன் பண்ணும் போது உங்களுக்கு வெயிட் லாஸ் நல்லா இருக்கும். ஆனால் மசில் லாஸ் ஆகும் போது மெட்டபாலிசம் கம்மியாகும். நாளைக்கு நீங்கள் டயட் நிறுத்தினீங்க, எக்ஸசைஸ் நிறுத்தினீங்கன்னா பயங்கரமாக வெயிட் போடும். அந்த வெயிட்டு தான் டேஞ்சரஸ். திருப்பி குறைக்கும் போது சுத்தமாக குறைக்க முடியாது. ஏன்னா மசில் கம்மியாக இருக்கும், மோர் ஃபேட் இருக்கும். ஸோ எப்பயுமே கார்போஹைட்ரேட் இல்லாமல் சாப்பிடாதீங்க. ஆனால் கார்போஹைட்ரேட் குறைச்சிக்கங்க, ப்ரோட்டீன் அதிகம் சாப்பிடுங்க, கிரீன்ஸ் அதிகமாக சாப்பிடுங்க. ரொம்ப ரொம்ப முக்கியமான விஷயம் அது.
Superb, sir. Thank you so much. I think Vishnu Kondapalli, your carbohydrate question is also answered here. Johnson, thank you so much for asking this question because it makes a lot of sense. Next question is from Kavita Gusari. I have hypothyroidic issues. I'm taking 125 mcg of Thyronol. Weight is 68, 5.1 height. Help me to reduce weight, please. I'm a 23-year-old female. So thyroid is something that we have not yet touched upon. I would want you to answer this question.
So there are problems with thyroid. See, there are very tricky things with thyroid. What happens is, if the thyroid is less, hypothyroidism we call it, what happens is body will store more fat and you put on a lot of weight. When you take thyroid medicines, you conserve more water and still you can be obese as well. The fatty part of the weight loss happens, but the water retention still can continue as well. And second thing is, when somebody is replacing your thyroid, they will try to bring it to the normal level. But thyroid, when it's hypothyroidism, have more thyroid medicines so that it bring it down to the lower level of normal. When you bring down to the lower level of normal limit, then you tend to lose more weight. The fat will be lost more. Then what happens? Because the thyroid level is normal now, when you exercise, you burn easily. So if 125 milligram you are taking, but see your thyroid, if a thyroid is at the higher level of normal, still can be considered normal, but this is not allowing you to lose enough weight. Maybe increase the thyroid level to 150 and bring it to the lower level of normal, you may be able to lose more. Second thing is muscle building. Everybody needs muscle building. You do a BCA, you will know how much muscle you have. You should have at least 30 to 35% of body weight as muscle. If you don't have that, improve your muscle. Take more protein, do some physical activity, improve your muscle, metabolism increases, and you lose more weight as well. So these kind of things are very important. And of course, fiber-rich diet, lean protein diet, and less of oil, more of a unsaturated oil are much better than a saturated oil. So try to change these kind of diet changes, which can also help you to lose easily.
Wonderful, doctor. Thank you so much, because the water retention part that you have answered. I think my personal question comes into place here. Though I manage my hypothyroidism from a very long time, I feel that my face retains a lot of water. I do exercise, I manage my weight well, but there are times where I feel really puffed up and bloated, and now I think I have an answer which is coming. Explained it closer.
That's very true, sir. Actually, reduce the amount of water in the body. You will tend to not, put on a lot of. But a lot of people in the early morning they have puffy face as well, and that is
Yes.
depend on the hormone system as well. So not necessarily thyroid, even your period hormones, ovarian hormones are necessary for it. But unfortunately for women, they tend to put a lot of facial puffiness in the early in the morning than men. So these are all the partialities which women get from the
So
hormones
you
as
got
well.
to live with
So
it. You got to have a positive body image and let the body do its own work, which doesn't do
that
any
is very,
harm.
very true. Yes, definitely. There are some good food also. Have kind of a lean protein food, reduce the amount of oil you use, and then sugar you reduce. So what happened? Your body will not store too much of water because of the osmolality, and that way you will look a bit lean as well, and the body will not be so puffy as well. So small changes, and then of course lot of things because of the allergic food as well. So try to find out after which food you feel puffy the next
Bloat
day.
or puff.
Avoid those food in the nights. Yeah.
Wonderful, doctor. Thank you. Manish Sharma ji पूछते हैं cold weather hibernation will that cause low metabolism and non-veg diet, beer consumption, all these can they affect your metabolism and obesity?
So beer consumption for sure because it's a high calorie, and when you consume beer, we don't consume just beer alone. We have two snacks, especially fried items. Naturally, you will have more calorie. If beer is
Yeah.
200 calories, you have 200 calories from the snacks as well. So you tend to have more calories when you drink. And the problem is when you consume this alcohol, you consume it late in the night, beyond 6 p.m. Taking any high calorie is dangerous to you. But the good high calorie alcohol and snacks comes late in the night, which are not used by the body because metabolism is not possible in the middle of the night. Everything gets stored in the body. Take
Okay.
the same beer in the daytime, it's okay. But unfortunately, you have to go to work. So we will always say, have beer on a Sunday morning and not other days to make it much easier for you. Because we cannot say don't take beer. Because worldly pleasure wise, taking your beer out of your system is not right. But try to play around, play smart so that you enjoy that as well. At the same time, you don't put on too much weight as well in the night.
Yeah, and cold weather metabolism, does it have any link,
Yeah.
doctor?
Yes, definitely. See what happens. We Indians are having less muscle mass than the Westerners. Westerners, because more muscle, they have better metabolism. So if they don't eat, they lose good weight, and they do a lot of physical activity by walking. We don't do that because of the weather. We have hot weather. We don't go out, and we have less muscle mass. So we have to be physically active to metabolize. In cold weather, when we go, be indoors, metabolism crashes down by one third, and that is the time when we eat much more calorie food as well. Little bit of more calorie rich food, less physical activity, and metabolism comes down. You tend to put on more weight in the winter than summer.
Yeah, right. So yeah, please do have a sip of water, doctor. We understand that. Yeah, so it does make sense that you need to exercise more and keep yourself moving in the cold weather.
That's very true.
All right. So thank you, doctor. Next question that I would want to take up is Rashid and Rohit. Both of them are asking about they want to increase weight.
Oh, it's nice to hear somebody wants to increase weight in this generation.
Yes.
So again, weight increase basically first you understand the body composition again. Even if you are not, if you are very lean, you must be having much more higher metabolism, maybe genetically as well. Second, you will have less fat mass than the muscle mass. You must be having low calorie amount of food or a empty calorie food. So these are all the reasons why your metabolism is very high and you are burning everything, or you are not giving enough calorie for the body to function. So for these people, we say don't try to take too much of a calories by ice creams and sweets and chocolates because you will end up having diabetes later. So we will
Right.
tend to increase the calorie by means of more carbohydrate based food. But again, the balanced meal is important. Protein is important for the day. But the good news about fat is the more fat you take, it will give you calories, but you will not store more. But the more carbs you take, beyond the carbohydrate what your body needs, it will store as fat. So always we say have normal carbohydrates, never take more carbs. So
Okay.
50% of your meal is carb, 50% of your 25% of meal is protein, and 25% of fat are the best way for these people to put on weight. For weight loss, we will say 25% carbohydrate, 50% protein, and 25% fat. But fat is important for immunity. So for you not to feel get sick and everything, you need fat definitely. But carbs 50% will help you to gain some more weight. And protein is important to build up muscle, which also will build you weight as well. So for these
Wonderful.
reasons, have a balanced diet with more carbs.
Right. So here's the next question, which is a registered user's question. Here's I'm over 100 kilos. Pari is 31-year-old male, over 100 kilos. Suggest me a diet plan to reduce weight. So I would want to place this question before you. There are certain weight or there are certain weight brackets. Can these be managed with diet only? And are there any other treatment options?
So when it comes to weight loss, by fact, when you are overweight, that is 0 to 10 kilos more than your ideal weight, there is a 70% chance you lose by lifestyle changes. Still 30% of them will not lose because they are in the uphill problem with their metabolism or some kind of a disease process that's coming in. This is
Yeah.
where when there is a weight gain, you address it scientifically, understand the reason behind weight gain. If you miss the boat, beyond that you end up having obesity. Once you tip over into obesity, the chances of you losing weight becomes only 30% by diet exercise. You
Right.
get into a morbid obesity, which is 30 kilos, 40 kilos. Chance becomes 5% by diet exercise. This is basically because your metabolism comes down to such a low level, there is a negative balance. The amount of food you eat, the amount of calorie you spend will be so much different. It crosses the 400, 500 calorie negative balance, which is the borderline beyond which we will not be able to lose enough by diet exercise. So that is very important to understand your metabolism, the negative balance of the calorie you taking, as well as the kind of a food you eating. This is very important, and this can be approached scientifically only when you meet a healthcare professional and not just a physical trainer or not just a nutritionist alone. That is why we have a new branch of medicine called lifestyle medicine that has come in. Understand these things and accordingly. But when you become morbidly obese, as I told you, only 5% are able to lose weight by diet exercise. So for these people, we tend to add medicine to lose more weight. But what happens with medicine is, if you are able to lose 5 6 kilos by diet exercise, medicine will add another 5 kilos. So still you can lose only 10 kilos as an average. There are some people who can lose more, but as an average, you lose 10 kilos. Is that good enough for 100 kilos? Definitely not. So for these people that accept the 5%, rest of them need much more stronger one, which can be something called as a endoscopic procedure, the balloon procedures, or bariatric surgery. But if you cross 30 to 35 kilos beyond your ideal weight, then the high chance other parameters might fail most of the time. That is
Right.
when we recommend bariatric and metabolic surgery depending upon what problems you have. Just for weight alone, we will not recommend that much procedure of bariatric and metabolic strength. But if you have a diabetes, hypertension along with it, or a sleep apnea along with it, then we recommend strongly. But if you go into morbid obesity, 40 kilos, 50 kilos, then we recommend bariatric surgery straight away. So,
Right.
depending upon which stage are you, we recommend accordingly. For 100 kilo, you should be too strong to do lifestyle changes, but to keep it in mind, there is a possibility, strong possibility, you might not lose enough. If you don't lose enough, try to move to the next level and don't be adamant about only lifestyle changes because your health and longevity is more important than your ego.
Absolutely, sir. So bariatric is not for everybody, but there are certain population who require bariatric, and that can be consulted. You can consult our bariatric head at Apollo Hospitals, Chennai, Dr. Raj Palaniappan. His link to consult is given in the description box. So here's a question about abdomen fat. नाम नहीं दिया है, age नहीं दिया है. 80 kilos. He's from 60 to 80. They have increased weight. Accumulation of fat around the abdomen. Nothing else that they've given. They would want to lose weight. What does the fat around abdomen show and talk?
Okay, so the most important part of any obesity, which differentiates a non-risky obesity to risky obesity, is the abdominal fat. Because the more the fat in the abdomen, that means more circulating free fatty acids. The more circulating free fatty acids, the metabolic syndrome X I told you before, sugar, BP, and cholesterol. These three becomes very, very serious issues, and these are very common in this abdominal obesity. One. Second is, the more the abdominal fat, this can be stored in the organs as well, what we call
Yeah.
as a visceral fat. The more the fat stores in the organ functions becomes less. One of the example is a fatty liver. Fat in the liver has four stages. When the first stage, only extra fat. Second stage, that fat cells will replace few of the liver cells. Liver is very important for your metabolism, for your digestion. Then what happens? It goes to a stage 3. Once it crosses a stage 3, more liver tissue are damaged, then
Yeah.
this liver starts failing. So it's not that only alcohol kills your liver. Even obesity fat can kill your liver, and liver cirrhosis or the failure will start. The same way in all the organs, blood vessels, liver, heart, everywhere it stores means it gives trouble. So when there's an abdominal fat, the more chance of metabolic diseases, the more chance of a lifespan coming down. So we always address when you are obese and you have an abdominal fat, we will say get treated at the earliest, otherwise you'll end up some diseases. If you have a family history of diseases, you'll end up being a disease problem at as early as even 20s and 30s. That is why nowadays you see people with diabetes at 18, 20s of age, cardiac risk at 18, 20. You see people dying pretty early because of this syndrome, which is because of the abdominal fat, which can lead to these diseases pretty early in their life.
Yeah. So here, in continuation of the same answer, registered user is Pratima Golcha, 48-year-old female. Control how to control belly fat. I'm bedridden. I cannot do any workouts. Diabetic and also have high blood pressure. So can bariatric or some surgery be an option for such people?
So exactly. So this is where bariatrics comes in very handy. When you are sedentary, when you have disability where you cannot move around, when you are obese, when you have diseases, you tend to not use the body exercises as a part of your weight management. Again, weight loss and weight management, diet alone cannot help you to do the management part. You
Yeah.
need exercise to do the management. You can lose weight by not eating enough, but how long? Beyond a stage, you need to come back to your normal eating, otherwise, you will have diseases to kill you more. If you don't exercise, you will not be able to maintain. For these patients with obesity, with diseases, bariatric and metabolic surgery is the first choice, not necessarily after the failure of other choices, because
Right.
your lifespan and your quality is very important. For these reasons, these surgeries help you to improve your quality by 95%.
Yes, yes, yes. And who requires it is to be decided by a person who's a specialist in the field of bariatry and it's in bariatrics, and it's not for everybody to decide. So as we were talking, आज इतना information है, we have so much of information around us. Technology has brought every information possible. Everybody tries everything out and then reaches out to a lifestyle medicine. So, when is the right time? When is the right age? What is the right time to consult a lifestyle medicine specialist?
Okay. So first thing first is, whenever you think your body is not as good as what you think. For example, you think you are obese. When you have fever, when you have cold, you meet a doctor. Same way, when you are obese, you have to meet a doctor. It is nothing like I will gain 20 kilos only then I meet a doctor. The problem with obesity is because there are plenty of people available in the world to give you gyan, because internet is an unverified area where I have lost weight by my whatever means, I will become an influencer. I will have all the YouTube videos and channels to say that how to lose weight. But you might not be the person who can lose weight by my means. You need some other means. So I will say anybody who is increasing more than 2 kilos a month need a consultation immediately, because your body cannot gain beyond 500 grams to 1 kilos by eating alone. There is something else which is wrong if you gain beyond 1 kilo every month. So meet a doctor to understand there could be some hormone problem, nutrition issue, or your metabolism is too low, whatever eating it is stored. So these doctors can help you to tweak your lifestyle, tweak your diet pattern and exercise pattern, so that you can crash the weight easily in the next month itself. But instead of
Wonderful.
doing that, you do gain 10 kilos, 15 kilos, then go to a doctor. It is that much difficult to lose weight.
वेरी वेरी वेल सेड. थैंक यू डॉक्टर. सो चेतन कुमार जी, पूरा सेशन हमने वेट लॉस मैनेजमेंट के बारे में किया है. जरा पहले से ये रिकॉर्डिंग वर्जन भी आपको अवेलेबल रहेगा, पहले से देख लीजिएगा. Thank you, Dr. Raj. I think we are running short of time for today and I'll not be able to take further more questions. But today I would want to close on top tips to understand weight management in diabetes, thyroid and other chronic diseases.
So, when it comes to weight loss, there are four things which always everybody need to understand. One is basically because of the diet. One is because the second is because of the activities. Third is because of the behavior what you are going to change, and fourth is because of the diseases, because of hormones or any other metabolic effect. So, try to have a good diet. The tip is you have a lot of lean meat. So that means fish, maybe a skinless chicken, or little bit of red meat here and there. Have more tofu, more paneer kind of a thing, instead of maybe too much of a oily non-vegetarian food. Have lots of good carbohydrates by means of having quinoa, or having red rice, or having whole wheat bread kind of a thing, and having a double boiled, or what is it, like double refined oils and things. Then third is oil, where you have a cold press oils. Most likely you can use avocado oil, which is one of the best oil what we can use. Maybe a little bit of a coconut oil, because you have mono unsaturated and polyunsaturated fat, oils which are much better than saturated oils. Having sunflower oil is good, maybe when it is not too much refined. So cold press sunflower oil is better. So if you are using sunflower oil, use cold press sunflower oil. So this kind of oils you use, and this is the kind of a balanced diet with more protein, less carbs, and less fat. You will be able to maintain yourself well. Exercise wise, 20 to 30 minutes every day, do some activity, some walking, jogging, or some weight training, yoga, whatever you do. 4 to 5 times a week, it's must to do some physical activity to keep the muscle toned. Only if you keep the muscle toned, you will be able to spend enough calories in the day, and a good food will help you. Third is behavior, a good sleep, reduce your stress. It is easily said than done, but you have no choice but to do these things. Maybe you tend to have a good kind of a good relationship with colleagues at work, and try to reduce as much as possible, reduce the kind of a work you do beyond 8 hours, so that you spend more time with your family and friends, so that you will reduce your stress and behavior. Fourth, very important, if you have a smallest of problem, like for example, as I told you, if you gain 2 kilos, 3 kilos suddenly in 2 to 3 months, meet a doctor to understand what it is. It could be a thyroid problem. It could be a period issue. It could be a diabetes. It could be some other small hormonal changes. Understand the disease process and accordingly medicate yourself to get the disease early. You will be able to maintain yourself very well. So I will always say that follow these 4 steps: good diet, good activity, good behavior, and make sure that you understand your body with the diseases. You will be able to maintain yourself very well if the right scientific help is given to you.
Thank you. Thank you so much, Doctor, for this wonderful session. Thank you, Dr. Raj Palaniappan.
Thank you so much.
Thank you. So here we head to health quiz, which is a 3-question quiz, where I'm going to answer, where I'm going to ask you questions, and you got to answer your answers on YouTube chat only. And winner's name will be announced towards the end of the show. Winners will be selected at the sole discretion of Apollo 24/7 team. And if I take your name as a winner, please do write back with all your contact details to marketing@apollo247.com. Gift vouchers will be shared with you. चलिए आज के 3 क्वेश्चंस आपके स्क्रीन पे डालते हैं. प्लीज फिल इन द ब्लैंक्स. डी से शुरू होता है. DI-B-T-S. In this word, sugars are stored in our body as fats. Question number 2. True or false? Thyroid does not have any impact on our weight. Is that true or false? Question number 3. Yes or no में answer कीजिए. Not sleeping enough can cause weight gain. These are the 3 questions. Please go ahead, type them in the YouTube chat box, and I'm waiting for the answers. Yes, I see the seasoned participants and people who regularly participate are typing first. All right, here are the coupons that we give away. Here are the coupons. The first one is ASKDOC150, Ask Doc 150. You can use this coupon on Apollo 24/7 to consult top doctors direct from Apollo hospitals and get up to 150 rupees cash back on online doctor consultation. And today's doctor specialist in bariatric, you can consult him, Dr. Raj Palaniappan, and use the coupon too. The description box or the chat box has a link to meet him and consult him. And the next coupon that we give away is code FIRST3, FIRST3. You order medicines direct from Apollo and get 25% off on online medicine orders and get up to 2 hours delivery as well. And the third one that we give away is HH247. You get 199 off on online consultation with Apollo doctors and up to 20% off on medicine orders. This can be used in addition to the other coupons that we have given away today. All right, so we are also on Apollo 24/7 is also on WhatsApp. You can call or WhatsApp text kar sakte ho. You can book medicines or book diagnostics to avail healthcare services. Do dial 9355-247-247. This is the WhatsApp number of Apollo 24/7. चलिए आज next week we are going to talk about a very, very important subject, because half of the India is flooded and we are experiencing severe monsoon, and floods do bring a lot of infectious diseases. Let's do a monsoon survival guide next week. Shielding yourself from infectious diseases, 23rd July, 11 a.m. Let's go ahead and talk about the safety that you have to maintain in the monsoons. I'm waiting for our, a lot of people are answering. I'm waiting for the team to select who is the winner for today. I'm still waiting, but yes, thank you all for joining us this week. Dr. Raj Palaniappan, special mention and thanks to you for being very, very informative, and taking care of our health is priority. My dear friends, do download Apollo 24/7 app and do follow us on Instagram, Facebook of Apollo 24/7, and also our YouTube chat box, YouTube channel. Do follow us for more such informative sessions. Today's winners are Lavanya CNM, Ramya Nagraj, and Kavita Agarwal. Congratulations. I repeat, Lavanya CNM, Ramya Nagraj, and Kavita. Please write back to us at marketing@apollo247.com to claim your gift vouchers. फिर मिलते हैं. नमस्कार.